Hi.
Hi, Kara.
Yes. How
Oh,
are
hi there. We
you?
can hear you perfectly fine.
Perfect.
Okay. Just waiting for Kelly, Toby, and Elizabeth to join, and then we'll let everybody into the out of the room. Okay.
Sounds good.
Thank you.
Thanks. Hi, everyone. Good afternoon. Thanks for joining today for this information session to becoming a certified application counselor or a CAC. My name is Kara Chiv. I go by Kara as well, and I'm MassHealth External Training and Communications Manager. I also oversee the CAC program, and for this afternoon, we'll be giving you a lot of the information related to our program as far as what it is and how your organization can partner with us in this program. So going on to the next slide. Okay, so as far as the CAC program or Certified Application Counselor program, in Massachusetts, MassHealth oversees the CAC program in partnership with the Health Connector, the Massachusetts Health Connector. This is a voluntary program for organizations to participate in. CACs, also commonly referred to as certified assisters or enrollment assisters in the community, help individuals and families seek healthcare coverage, complete an application, help individuals provide or submit supporting documents to MassHealth or the Health Connector. They can also help members renew their healthcare coverage, and it can also help translate the letters that they receive from either MassHealth or the Health Connector. So no one pays for the services they receive from a CAC, or do they need a CAC to complete or submit a MassHealth application? CACs are out in the community to serve as an additional resource to help individuals complete their application or their renewal, as most often our members aren't able to, or they just don't understand our application and our processes. Going on to the next slide. To become a CAC, individuals need to work or is appointed by the CAC designated organization. A tri-party agreement is completed between the interested agency and MassHealth and the Health Connector. So currently out in the community, MassHealth partners with over 200 CAC designated organizations. And you can find a lot of the CACs, mostly, but not always, at local community health centers, hospitals, and we do have several at community-based agencies. So what's the process to becoming a CAC? CACs are required to be certified by MassHealth. They go through a self-paced training in the Assister Learning Management System. We do provide the LMS and all the tools needed for CACs to train, and additional resources and job aids to support them in their role. CACs are also required to maintain their certification yearly and be in good standing as they help applicants and members through their application process. Moving to the next slide, here you have really the high levels of the roles and responsibilities of a CAC. As far as their responsibilities, they work or volunteer for their organization that has partnered with us. They complete the initial CAC training. They, like I mentioned, they need to maintain their status as well as recertify yearly. And we do ask CACs to not turn anybody away. They are willing and should be able to support our applicants and members out in the communities. As far as the benefits of becoming a CAC or a CAC designated organization, once a CAC organization is designated, you can have more than one staff or as many team members as as needed for your program. You'll be able to be prepared to help individuals complete an application or their renewal. You'll also have access to certain MassHealth or Health Connector and Health Connector systems to be able to check the status of the application and their renewal, as well as complete the application online. For those newer to our community, for members or applicants under the age of 65, we do have the online application, and when you are a CAC, you're able to access that application online to help the member real time complete their application. Going on to the next slide. So CACs, they do provide a full range of healthcare coverage options and offer education related to MassHealth programs and the Health Connector program. They help individuals and families complete and submit their application for health benefits and or their renewals. They work with the individual and the families to submit any verification of documents that's requested of them to ensure they maintain coverage. CACs also are able to interact with MassHealth and the Health Connector customer service to support them in their application and renewal process. They can also help facilitate enrollment into healthcare programs. CACs, on the other hand, do not make any decisions on whether the individual or family are eligible for any public health benefits or programs. They don't assist individuals with private health insurance applications. They do not get paid for the work they are doing out in the community by either MassHealth or the Health Connector. And again, they do not charge for the services that they provide as a certified assister. Moving into the next slide. So to find a local assister, you can go to Find Local Help. The tool is at mahealthconnector.org. And this tool can be used to find a certified assister. In our community, certified assisters include the CAC, the certified application counselor, as well as navigators. Navigators are another certified assister out in the community. They are funded by the Health Connector to support Health Connector enrollment, but they can also support MassHealth members and applicants. So you can quickly find a certified assister through this Find Local Help tool, and it is online at mahealthconnector.org. Going on to the next slide. And that's it as far as the CAC program. Just wanted to give you a little bit of information related to the training. On average, we have heard from assisters that it may take them around 10 hours to complete. But for somebody that is newer to the healthcare space, 10 hours would get them through our training materials, but they may take a little bit more time in understanding our application, our processes, and that's okay. There are a lot of opportunities for certified assisters to get support from my team mostly, as well as our platform where we do provide updates related to MassHealth, and that is done on the MTF, at the MTF, that's the Massachusetts Healthcare Training Forum. So there are a number of platforms for which we do provide a lot of support to our certified assister community. Make sure that they are most up to date with information about MassHealth as well as the Health Connector program. So with that, I think there are a couple of questions that's already in the chat, and we can open up the line for questions. All right.